Hello everybody and welcome to the monthly parent training session for this month. My name is Gary Long and I am one of the BCBAs with Kaleidoscope Interventions. I am currently providing services for the in-home section as well as at Puzzlebox Academy in Palm Bay. Today we're going to talk about attention maintained behaviors. So with that, let's get started. So here is an overview of what I will talk about today. We'll start off with what are attention maintained behaviors. Next, I will explain the process used to determine if the behavior is attention maintained. Then I will discuss how do we treat attention maintained behaviors. Following that, I'll let you know about some of the side effects of treatment and then move into discussing some of the barriers to treatment. Finally, I will discuss how parents and caregivers can implement treatments for attention maintained behaviors. So this brings us to our first section. What are attention maintained behaviors? Attention maintained behaviors are one of the common functions of behavior that BCBAs target. Behavior analysts classify behaviors usually into four functions. Along with attention, there is escape, which is when someone is trying to get out of doing a task. There is denied access, which is acting in a way to gain access to a preferred item or activity. And there is automatic reinforcing behaviors, which are behaviors that are internally reinforcing, such as motor stereotypy and vocal stereotypy. We exhibit attention maintained behaviors to gain some form of reinforcement from others. These behaviors can be perceived by others as good behaviors or bad behaviors. Next, I will provide you with some examples of attention maintained behaviors. Some common examples of attention maintained behaviors that everyone exhibits are talking, texting, posting on social media, and with that you're trying to get likes, comments from others. Also got calling out in class, which is trying to get attention from your classmates or teacher. Telling jokes to coworkers, trying to get those laughs from them, and bringing flowers to your significant others. Now I'm going to give you some examples of attention maintained behaviors I've seen while working with clients. I've seen aggression out of clients. I've also seen elopement and yelling. I've also seen perseveration, or repeating a phrase such as a man, such as "can I have the iPad?" And this is a repetitive repeating. So, "can I have the iPad?" No. "Can I have the iPad?" No. "Can I have the iPad?" No. It's kind of an example there. I've also seen clients flip over their desks in school to get attention from the teacher. So with that comes our first question. What is an example of attention maintained behavior? I also would like to note that there are 4 questions within this whole presentation today. And I've listed all 4 questions at the end on the last slide. That way you can have all 4 of them in one spot instead of having to pick through the entire thing. Or you can just sit here, watch the video, and answer them as we go. Your choice. I'd like to give you options. So moving on, we're going to go over how do we determine if a behavior is attention maintained. So we do not make a guess or consult with the magic 8-ball to figure out why a behavior is occurring. We do it through a scientific process. It starts with performing a functional behavior assessment. This usually involves interviewing parents, guardians, caregivers, and teachers, typically done during an intake evaluation. We also like to do direct observations of the behavior or collect data such as ABC data. BCBAs usually develop a hypothesis as to the function from the results of the functional behavior assessment. Once we have a theorized function, we summarize the function in a treatment plan. Here is an example of how I list the behaviors and their functions within a treatment plan. This particular client did not exhibit automatically reinforcing behaviors, but he did have escape, denied access, and attention maintained behaviors. If you would like to know the function of your child's behavior, look at their treatment plan or ask their BCBA. Once we have a theorized function, we test our hypothesis through the use of different treatment designs or protocols. For example, we may start a particular protocol for an attention-maintained behavior, and after a period of time passes and the behavior reduces, then we remove the treatment protocol to see if the behavior reemerges. If it does, we then put the treatment protocol back into place to see if the behavior decreases. This gives us confidence that we determine and are successfully treating the target behavior. Sometimes we cannot confidently determine a function just from the functional behavior assessment, or our treatment protocol is not working. It is common for a client to use attention-seeking behaviors to escape from demands or gain access to preferred items or activities. In these instances, behavior is pretty much referred to as having a multiple function. In these instances, we perform a functional analysis on the behavior, which a functional analysis is typically done in a controlled environment, and through that we're able to determine and or rule out other functions of behavior confidently. So to show you guys all some multiple control or multiple function behaviors, we're going to go back to our little snippet out of a treatment plan. And if you look here, pretty much every behavior, every target behavior this particular client engages in falls into multiple different functions, like non-compliance, all three functions that are listed here that client engages in. The only one that's slightly different here is tantrums. Tantrums typically aren't done for attention, but he does do it for either denied access or escape from demands. So this is a good example of multiple functions of behavior. So in instances where we cannot determine a function from a functional behavior assessment, we will perform a functional analysis on the behavior. Again, this is done in a controlled environment, and we test different conditions to see if the behavior occurs. We start off with an alone condition or ignore condition, where we put a client in a room and either leave them alone or with a staff member, depending on the age of the client, and just kind of ignore them and see if the behavior occurs. We then go into attention condition, where the client receives attention, usually on a 15 or 30-second interval, so they get inundated with attention, and we see if the behavior occurs. Then there's the demand condition, where we place a bunch of demands on the child for the period of time throughout and see if the child engages in the behavior and provide them a brief temporary escape from the demand once they engage in the behavior. Then we have a play condition, which the client gets to go into the room and pretty much do whatever they want with all the toys and everything in the room, and we watch and see if the behavior occurs. And then occasionally we will do a condition called tangible condition, where it's for access to a specific item, such as an iPad or tablet, a parent's cell phone, whatever the case may be, and see if they engage in the behavior to gain access to that item. So how do we treat attention-maintained behaviors? One of the treatment approaches I like to use is planned ignoring. Here on the screen is a funny cartoon graphical depiction of planned ignoring, where a mom would like to decrease tantruming behaviors using planned ignoring, and in step 3 she ignores the tantrums as it occurs. Another treatment method is differential reinforcement of alternate behaviors. We teach the child appropriate ways to gain attention and then praise when they use the alternate methods, which is depicted in step 4 on the graphic. Some examples of alternate behaviors is raising their hand in class to gain the teacher's attention, or appropriate manding or asking for attention, such as calling your name or tapping you on the shoulder. Another treatment approach I sometimes use is time-based attention, where we give attention on an interval schedule, such as every 5 minutes, so the client gets the attention, thus reducing the target behaviors. The last example is pivot praise, which is used in the classroom by teachers. This is where the teacher ignores the client's tantrum behaviors and praises the appropriate behaviors of other students in the classroom. And as the client sees the other students receiving attention from the teacher, the tantruming client then starts imitating the positive behaviors that the other students are imitating so they can, or exhibiting, so they can gain that attention. So now this brings us to our second question of this parent training session. What is one treatment approach for attention maintained behaviors? The first side effect we're going to talk about is the extinction burst. An extinction burst is an increase in the target behavior or intensity of behaviors once treatment begins. An extinction burst can be dangerous, especially with a client that is prone to engaging in self-injurious behavior or aggression. I once worked with a client that attended a charter school in my local area, and this particular client would engage in some attention-seeking behaviors, such as calling out to the teacher and whatnot. Well, this particular client, as the teacher would ignore him, the client would then escalate. The client would start balling up paper and throwing that around the classroom, trying to get attention from the teacher. The teacher would continue to ignore, and this particular client would then start eloping around the classroom or getting down and crawling around the classroom, pretending to be a cat. Eventually, this client would get to the point where he was engaging in some form of property destruction, where he's flipping desks over or breaking things. He went to a bookshelf and pulled a book off and started ripping the books in half. I've also seen the client engage in aggression towards other staff members, or actually start engaging in self-injurious behaviors, such as scratching his arm or banging his head on the desk. So with that, you have to be mindful of the side effect, especially an extinction burst when dealing with attention-maintained behaviors. Another side effect of treating attention-maintained behaviors is limiting communication growth. Clients who are just learning to speak may not receive enough reinforcement to maintain their newly acquired words, and so limiting reinforcement could impact speech development. These side effects are one reason you as a parent or caregiver should speak with your BCBA prior to attempting any treatment. Your BCBA would be able to advise you on the best method to help you with the behaviors you're seeing at home. Now we have our third question for this parent training session. What is a potentially dangerous side effect of treatment? So now we're going to move into some barriers to treatment. The first barrier to treatment is inconsistent treatment. This is where we are treating a behavior in clinic or school, and we have trained the parents or caregivers how to implement the treatment at home. The parents have been trained in the treatment protocols out of the client's behavior improvement plan. The parents typically are assessed in their ability to implement the protocol up to a certain standard, and then they implement it at home. These particular parents implement the treatment initially, but then slowly stop, or just kind of stop engaging in it for whatever reason. Maybe they got tired or caught up at work, whatever the case may be. And eventually the parents started to give in to the behavior. Now the behavior is increasing at home because it's still being reinforced by the parents. However, in the clinic, sometimes the behavior remains the same or stays low, and we start getting that contrast between the different environments. And we do refer to that as behavioral contrast. Another barrier to treatment is inadvertently providing attention. Example of this is a child acting out in class and the teacher reprimands them. A kid gets up and starts running around the classroom. The teacher yells at him to sit back down. Another example is other students' reactions. For instance, in the earlier example where I mentioned a client crawling around the classroom pretending to be a cat, sometimes this particular client would engage in this behavior, and the teacher was trained to ignore that attention-seeking behavior. However, the other students in the room would make comments and give reactions that provided this particular client his attention. Another example happened when I worked with a client at a local private Christian school. The client would yell out comments that contained profane language, and as you can imagine, in a Christian school, the teacher would usually reprimand the client or otherwise provide some form of attention to the client and even kick them out of the classroom, send them to the principal's office. But eventually she was taught to ignore these clients. However, anytime the client would yell out profane comments in class, his classmates would react in such a manner that would provide that attention to the client. Another barrier to treatment is intervening due to safety. Examples of this is blocking self-injurious behaviors or blocking aggression. A client engaging in self-injurious behavior or aggression, especially in high intensity, must be blocked. We cannot risk having a client injuring themselves or significantly harming themselves in an interest of just minimizing attention-seeking behavior. However, the act of blocking is providing them enough attention to maintain the behavior. In these instances, we try to limit attention when we block the behavior from occurring. I once had a client who started to bang his head on a desk. I walked over and placed my hand in between the desk and his forehead to lessen the impact of his head hitting the hard surface of the desk. When I did that, I withheld eye contact and I didn't even speak to the client. And I probably even engaged in side conversations with the teacher or other staff members in the room while just actively blocking that self-injurious behavior. The client in this scenario was still receiving attention, but that attention was limited, and that limited ability or that limitation of the attention did allow some decrease in the behaviors. However, the client still was receiving that attention that slowed the decrease in that behavior over time. So the next segment we're moving in is how can you as a parent or caregiver implement the treatment protocols? Well, the best way is to get some parent training from your BCBA. While you're getting that parent training, you want to make sure you understand why the behavior is occurring. That way you have it even in your subconscious to know, oh, he must be doing that for attention. This is what I'm supposed to do for attention-seeking behavior. You also want to specifically know how to implement your child's behavior intervention plan, commonly referred to as a BIP. You want to know these protocols, and as I've earlier mentioned, we train you to a standard of implementation of the protocol. That way you know exactly what to do, or should know exactly what to do when you're in environments outside of the treatment areas, such as the school or clinical environment. Even for my in-home clients, I train the parents there in the home, but they also need to know how to implement that same protocol when they're out in the community or at another family member's house, whatever the case may be. You also need to receive training on how to collect data. For instance, ABC data. ABC stands for antecedent behavior consequence. Antecedent is what happened immediately prior to the behavior. For instance, I have a client that his little brother will come up and snatch the toy from him. That would be the antecedent. This particular client would then hit the brother, usually with an open hand. That would be the behavior. Aggression towards brother, hitting with an open hand. The consequence, or what occurs immediately following the behavior, is typically what occurred immediately following it. So in the instances of the brother hitting the little brother started crying and then the client was scolded by the parent and then put in the timeout. That all would be from the little brother crying to being put in timeout would all be the consequence data that go in that column. One final thing I want to say about the behavior, the B in that ABC thing, is we really want to know the topography of the behavior so we know exactly what it looks like. You know, open hand, closed fist, banging forehead to the table, because even as small as it seems, it could change the function. You know, there's a difference between a client banging their head on a hard table versus banging their head on a soft cushion of a chair. So other ways that parents, caregivers can implement treatment protocols is be consistent with implementing the treatment protocols. Don't only do it in one area or one instance, but not other instances that also fall under the same function of behavior. Or doing it at home, but not implementing the protocol at, say, a family member's house. You know, this is very important. You have to have consistency for behavior change to occur. Otherwise, the clients could get confused or just not respond to the treatment. You also want to make sure other family members know what to do in regards to responding to behaviors. You know, a lot of people interact with their extended family, you know, your grandparents, aunts, uncles, siblings, and even non-custodial parents. A lot of these family members, the client goes and spends a little time with, let's say, a non-custodial parent. The non-custodial parent's not trained on implementing the protocol, doesn't understand the protocol, and then the client ends up regressing in behavior. That is actually a very common occurrence. I even dealt with it with my own children when they would bounce between living with me and living with my ex-wife, or going to go visit my ex-wife. That is just the nature of the game. You have to make sure everybody's consistent and on the same page. Some more ways that you can implement the treatment protocol is what I've already sort of talked about with collecting data, but I have to hammer this point home because it is very important. Without data, I can't determine why the behavior is occurring, if our treatment protocol is working, everything that behavior analysts do. We have to have behavior. So pay attention to the behavior before, during, and after. You know, think of that, what we talked about a couple slides ago with ABC data. You know what's going on. Also, be open to collect other data as requested by the BCBA. A lot of times I like to collect frequency data or some other form of data on a particular behavior so I can document how much it's occurring, and then eventually utilize that measure for determining if the behavior truly is reducing or not. As always, communicate with your BCBA. You've made that point a couple times here. Utilize the communication logs. For most of my clients that are at Puzzlebox Academy, there's usually a log that stays in their book bag, backpack, however you want to call it, and the RBTs write the notes home, just talking about the client's day or any pertinent information. And the parents also can put pertinent information in there to pass on to the treatment team. Also, give your BCBA any data that they request after you take it. I have some clients that prefer to take like ABC data on digital forms through the computer. I sent them a nice Excel-based sheet that they preferred to use, and a couple sessions later, like, hey, I got some data for you. Here's what happened. They kind of describe it to me. I ask them to email that log to me so I can, have it in my records. And 6 months later, I'm still waiting on that information to get emailed to me. So it is definitely important to communicate with your BCBA, collect that data. If you're uncomfortable doing any of that or don't know how to do any of that or can't remember, talk to your BCBA, contact the BCBA. We'll be able to assist you and get you where help you understand exactly what we need. And here is your fourth and final question for this parent training session. How can parents or caregivers implement treatments for attention-maintained behaviors? So now we're at the end of our parent training session. Let's summarize what we talked about. We talked about what is attention-maintained behavior. We stated that attention-maintained behavior is anything that a client does to obtain attention of somebody else. Then we talked about how we, as behavior analysts, determine if a behavior is attention-maintained. We do this through our functional behavior assessment process. Then we talked about how we, as behavior analysts, treat attention-maintained behavior. We covered things such as planned ignoring, teaching alternate behaviors, then differentially reinforcing those alternate behaviors, or utilizing interval reinforcement schedules. Then we talked about the side effects of treatment, such as your extinction burst, or possibly limiting your growth, your communication growth of your child. Then we talked about barriers to treatment, which is inconsistent implementation of treatment protocols, or even other family members, extended family members not knowing how to implement the treatment protocols, creating those inconsistencies. Then we talked about how parents and caregivers can implement treatments for attention-maintained behaviors. We talked about you receiving that training from your BCBA on how to implement your child's behavior improvement plan, or BIP. You also talked about training up your extended family members or maybe a non-custodial parent on those behavior improvement plan protocols to help increase the effectiveness of our treatments. So with that, as promised, here are your 4 questions that were sprinkled throughout this entire parent training segment. The first question, what is an example of attention-maintained behavior? Second question was, what is one treatment approach for attention-maintained behavior? Third question is, what is a potentially dangerous side effect of treatment? And then the fourth question, how can parents, caregivers implement treatments for attention-maintained behaviors? And with that, I want to say thank you for your time, paying attention. I know it's tough when you're watching these things through video. And so with that, I hope you have a wonderful rest of your day.